Okay, hi everybody in the Mommy Berries community. I'm Mel, and as a pelvic health physical therapist that works with a lot of pregnant and postpartum women, I'm on a mission to help make more kind of proactive healthcare instead of such reactive healthcare. And so I've been really liking this community and this interview series as a way to kind of highlight who all of the experts are out there to help you. And I think that there's so much value in not only women educating themselves, but knowing who's around them to help them as they are on their recovery journey. And I'm really excited for this interview today. I have Elaine Sauve with me. She's in my community in Kelowna, BC, and she's an osteopathic practitioner. And so I know a lot of people like, she's a what? And every country is going to see differences in this professional. But I would say I've seen someone myself kind of after I had my first child, and I was like, wow, this is a really cool profession. And I've heard Elaine's name come up amongst like my clients often. And so I just had to meet her because I'd heard such great things. And I'll let her introduce herself, and then we'll get into how she's going to help you understand your body as a pregnant and postpartum woman. Anyways, thanks for being here.
Yeah, thanks for having me. Hi, so yeah, I'm Elaine, and I am an osteopathic practitioner. I trained in New Zealand. I really love working with moms and babies, and it's really special for me right now because I'm currently pregnant. So I get to experience all the things and that my clients talk to me about and tell me about. So that's been really special.
Awesome. How many weeks are you now?
I'm 29 weeks.
Ah, that's
Yeah,
good. So they have 30 weeks in
getting there.
after. It's really fun.
Yeah.
Absolutely.
So I know a lot of people don't know necessarily what osteopathy is. So just kind of, and I obviously always get this question because people are like, yeah, what is that? And it's always can be kind of difficult to describe how you're different or similar to other professions. But basically, it's a form of hands-on manual therapy. We really look at how the whole body is functioning as a unit. So we look at how all the different structures in the body are working. So it could be the bones, the joints, muscle, connective tissue, um, and the internal organs. And so that's something that really applies to what's going on during pregnancy and postpartum because there's so much changes and shifting through our bodies. So
Totally. And
yeah.
and that's why I thought I was really excited to have you on, because I know there are some questions that I get a lot. And even though I feel like I have a pretty good idea of how to answer their questions, I always I look forward to picking your brain to know a little bit more. And so I'm looking forward to this session. I know you guys treat very much kind of a whole body approach. And obviously, most of the changes for a pregnant woman are happening around the abdomen and the pelvis. So I
Mhm.
wondered, I know that you kind of showed me a really cool video that you had. And I wonder if you don't mind sharing your screen, and let's just kind of talk through with people some of the changes that are happening in the abdomen and pelvis during pregnancy as you grow.
For sure. So here we go. You see that?
I can.
Perfect. Make it a little bigger here. There we go.
Yeah, look at how, I always think, are you able to pause it?
Yeah. So
Look at,
I really love how it shows how as baby's growing, it's pushing all of the organs up to make space for baby. And you can see how everything gets quite compressed through this area. And, a lot of women describe that feeling of having it difficult to take a deep breath and,
yes.
not having a lot of space when they're, being really full easily when they eat. And you can kind of see why that would be because the stomach, all these digestive organs are getting pushed up against, the rib cage. So
Yeah, totally.
mhm. Keep going.
You can see less and less space to breathe,
Yeah.
less and less space to keep food.
Yeah.
Wow.
And then that's kind of neat. It shows, during birth, this is baby's been moving and growing, and it is fairly quick, but it's also, birth is so quick in comparison to how much things have been happening during pregnancy. And so all of a sudden we've had all these organs up at the top here, and now they're just sort of like coming down into this space where baby was just occupying. So
Exactly. So during pregnancy, obviously that's one of the biggest reasons why like digestion's slower, and probably one of the reasons obviously why we get more constipated
mhm.
during pregnancy. Um, what else? Can you speak a little bit to why women have so much heartburn?
Yeah, so heartburn, again, you could see how the stomach was really pushed up against the rib cage there. And basically, our diaphragm, which is our main breathing muscle, sits like this big dome underneath the rib cage. And so when everything's sort of pushed up into that area, it can cause the opening between the stomach and the esophagus to not open and close properly. And so when things are really tight and not moving very well, that can impact on that ability for that to open and close. And so we can get that heartburn, that things coming back up through the stomach.
Totally. And do you find that, if women come in to see you during pregnancy, that some of your techniques, which I know are very gentle,
Mhm.
some of your techniques can kind of help with some of that, with the heartburn, with the digestion
Absolutely.
issues? Like, maybe talk a little bit about what that might look like if someone came in to see you.
Yeah. So if I had someone coming in, describing those things to me, I would definitely be working on their diaphragm. I'd be working on their upper back, their ribs, just getting things a little bit more mobile and free. We could go through a few breathing techniques and things to just help kind of navigate that. And as well, you can work directly on the stomach. You can work directly on the colon, on the bowel itself. Every organ has connective tissue that wraps around it and attaches it, in different ligaments that attach it to various places. So we can work on those musculoskeletal kind of structures in order to help them be freer and to move a little bit better and to just accommodate those changes
Or
that's
like
happening.
maximize the space that it can, right?
Exactly, yeah, and it can help change some of the pressure. There's a lot of
Yes.
pressure that's building up through
Mhm.
all of this, and so it can kind of help normalize that as well. And
Awesome. And
yeah,
I wonder if you speak really quickly about the round ligament and what,
yeah. So I mean, the round ligament is an attachment to the uterus, and so a lot of women will complain of pain from that round ligament, and it's basically just it's getting stretched out. Sometimes the uterus doesn't always grow in, evenly. Basically, baby can sometimes decide to camp out on one side more than the other, and that can cause some pulling and shifting through that ligament and more stretch on it, and that can often cause pain for women, and why that is a really common pregnancy symptom.
totally. I know also too, then this is what took me to an osteopathic practitioner in the first place, is I had fractured my sacrum
Mm,
before I had my first. And so I was getting lots of tailbone pain. And I wonder if you could speak a little bit to that during pregnancy, kind of tailbone pain, and like what the role is of the sacrum in pregnancy.
absolutely. So the sacrum is one of the, like, if I was gonna treat one thing on every pregnant woman, it's definitely the sacrum. We want to make sure that the sacrum is mobile. So it has its own natural little bit of movement, and it moves in between those two iliac bones on either side. And so it has to do this bit of like up and down movement essentially. And so if it can't do that, then it doesn't allow as much accommodation for mom's pelvis as baby grows. And so that's really important during birth, because as baby descends through the birth canal, there has to be this movement of the sacrum back and forth to facilitate that process. And if that's stuck, not moving very well, that can impact on the ability for a vaginal birth, or sometimes can contribute, not always, but can contribute to a baby getting
Totally.
stuck
And
during.
obviously, like as someone that treats all the muscles that attach to the sacrum, I would
Mhm.
agree the same thing. Like keep everything as mobile as possible, because then the pelvic floor, which lets out the baby, has more freedom to move as well.
And previous injuries, sometimes we'll be like, oh yeah, I broke my tailbone however many years ago. It doesn't really hurt me now, but all of a sudden it starts hurting during pregnancy because there's so much more pressure on it. And something like that, there's a lot of compression in that bone, and our bodies don't always get rid of those easily on their own. So,
Totally. Just needs a little nudge. That's what I was so
yeah.
surprised when I went. I remember kind of laying there and thinking, oh my gosh, I don't even feel anything. This is so gentle. It's all, I felt like I needed like a crack or whatever.
Yeah.
But then I felt like magic after. And it's amazing how such gentle kind of treatments can be so effective. So I have felt it firsthand. Maybe can you kind of speak to, and I have felt this before as someone that's had two babies. After this, I always think of it like a balloon expanding, expanding, like you just showed. And
Mhm.
then you showed what happens to the organs after. And you kind of already answered my question. But after that baby comes out, I think a lot of women would describe there was a void there. Like your belly still is bigger. Your
Mhm.
organs don't feel the same, and I felt like there was like a deflated balloon. I wonder if you could speak to, like as we know, everything kind of has to settle back into some version of where it was before.
Mhm.
How long does that take? And I guess I have two questions. How long does it take? And maybe can you explain then why it's so common for women to have digestive issues in the early postpartum period?
Yeah, I think it can really vary in how long it takes. Sometimes women's uterus will kind of come back to its normal size quite quickly, and other times it just takes a little bit longer. So that can, it can kind of anywhere between, a few weeks, a couple months. It can take a little bit more time for some people than others. And it depends on too if you've had how many births you've had, a first birth versus multiple births, that can affect it as well. But yeah, when baby's born, everything can kind of drop back into place. And because things were, as I mentioned, pushed up the way that they are, all of those like fascial layers, that connective tissue that's around each of the organs, sometimes they can get a little bit adhered to each other. So they can kind of, rather than moving and gliding and sliding, they can get a little bit stuck. And a really common one is for the uterus to get stuck onto our small intestine. And so then when the uterus is shrinking back down to size, it can sometimes actually pull the small intestine with it. And sometimes that can be this feeling of being pulled down, and we can't always be as effective in terms of our digestion that way because of those restrictions between the layers. Hmm.
Perfect. And I think that, like, as you were describing that, do you still want this screen up, Elaine? I don't
Oh,
mind if you leave it. No,
yeah.
no, it's fine. I just, when you were showing me, I was like, oh, I wonder if I should make her bigger, but I don't think I have that capacity. I think you have to.
Oh, okay. Yeah, I will stop that now.
Um,
Great.
when you were showing that, I was like, I wonder, I always describe to clients, like, it's almost like everything inside is sticky, like and it doesn't always stay in its own lane. Like things
Mhm.
are able to stick together. And if they're used to being so smushed, like it's kind of natural that they might have a hard time separating again.
Yeah.
Um, and so what do you suggest then for people in that postpartum period that they would say, oh, my digestion is either so different or so slow or it's uncomfortable? Obviously, time.
Yep.
What else? What would you suggest besides seeing? Because that's the thing. That's what, like, someone like Elaine, this is like what they would work on with you to kind of help facilitate, that happy place of the organs and like happy movement of the organs, right?
Yeah. So I would say, I mean, if you had a fairly uncomplicated pregnancy and labor, coming in that like 4 to 6 week period is a really nice time to, when you feel ready to come in. But that's can be a great time to work on some of those structures and just help the organs and those fascial layers move a little bit better and just help your body accommodate the postpartum period, and kind of getting back to things functioning in a little bit more normal way for you.
Totally. And I have to tell my clients, like, don't hesitate to kind of massage your belly. Like,
Absolutely.
like
Yeah.
get in there,
Yeah.
and as much as it feels different and sometimes people don't like to touch it, start gentle
Mhm.
and just start getting everything moving, because you'd be surprised how much that it's almost like the area I would describe it sometimes looks a bit shocked. Like it just needs your hands, and it needs someone's hands to kind of reset it, to
Yeah.
feel like it can kind of,
Mhm.
oh, I remember this. This is my old home, right?
Yeah.
Will you talk a little bit about another thing that a lot of my clients postpartum would explain? And I remember feeling this too, that ovulation felt more painful for me, and that a lot of people feel more cramping with periods postpartum. Can you speak to that a little bit?
Yeah, and so, I mean, there's one aspect of that, and that all of the hormones are changing so rapidly, and just trying to kind of accommodate and get back to, their normal balance and rhythm again. But again, as far as everything's shifted and moved so much during pregnancy, and so when it's coming back into its usual homes, they can get a little bit stuck as well. And so even the ovary is tiny, it's quite small, but it still needs to have its own mobility, and the uterus needs to have its own mobility. And if there are any restrictions in those layers, that can just make things feel a little bit off, and not feel, feel a little bit more cramping. And so having treatment on those structures can help give them that mobility back again, and help return some normal function. And yeah.
Totally. I would say, so something that a tool I'm able to use just with the pelvic health training, I'm able to do some of this work internally. And how I always describe to clients, especially someone that was coming in with period pain or cramping,
Mhm.
one of the first things I'd think of was like, I wonder how much their cervix is free to move. And I always say, like, if I was to go in your vagina and feel your cervix, it would feel like the tip of a nose. And then I picture almost like a chandelier hanging down.
Mhm.
And the chandelier should be able to move. I always feel silly doing this, but I do this to everybody. This chandelier should be able to move up and down and side and side. Lots of
Exactly.
times I will feel the people that have that pain. It's maybe that it's like drawn over this way or
Yep.
something like that. And so can you imagine that every month when you get that cycle, as the lining is starting to fill and fill and fill, if that uterus is not able to freely move, that maybe you'd start to feel a sense of pull, or a sense, you might not feel pull, you might feel the cramping, right?
Mhm.
And so, and I sure felt that firsthand. Um, and then once I started thinking back to like that video you showed at the beginning, no wonder. I mean, if everything has to move so much, plus it's kind of on the sticky side, no wonder it's not going to just bounce back and be like, "Ooh." And I think it's important. I think you guys do a good job around this language for people to understand that things don't live in their own lane. Like, it's not like uterus stays here and bladder stays here and rectum stays here. And I think that that's important. You hear language all the time, like, my cervix doesn't move. Yes, it does. It just, do you know what I mean? Like, you hear some of this language, and I think it's important.
Mhm.
Like I said, you guys do a good job of explaining this.
Yeah, and they're all kind of suspended in different places. And so sometimes, yes, you can have the uterus, for one, can be pulled over to the right hand side, for an example. And sometimes we'll assess things externally, but we'll feel where that uterus is sitting, and you can be like, oh, okay, well, it can go up, it can go down, it can go left, but oh, I can't pull it to the right at all. It's stuck over here on the left. And so then you have to look at what's holding it. And sometimes it can be the fascial layer, sometimes it can be a different attachment point, sometimes it can be two organs that are kind of stuck on top of each other, and you have to work on trying to get those to move apart and be able to do their thing. So it's not always about one. You kind of have to look at what's going on around it as well.
I
Yeah.
feel like this kind of moves right nicely into my next question, which is, can you speak a little bit to C-section scars? Because I think, like, I
Mhm.
always picture, like, there's this nice C-section scar that lives right here, like right over the pubic bone, basically. But I don't think people picture what's underneath there. And I almost picture an iceberg sometimes.
Yes.
Like there's a lot of stuff underneath the skin. And I
Totally.
think we just did last week was all about C-sections. And I think it's so important for people to understand why we harp about like massage so much, C-section scar massage. So I
Mhm.
wonder if you kind of talk about what kinds of things you might notice with C-section moms.
Yeah, C-section, working on the scar is so, so important. And like you said, you see the scar from the outside, but we don't always think about all the layers that they've had to go through in order to get to your uterus so that they can deliver the baby. And there's abdominal layers and there's fascial layers, and so all of these things have to be cut through in order to have a C-section. And so sometimes in just that process, or the stitching, things can be a little bit even tighter on one side of the scar than another. I've seen a lot of mums who haven't had any work done on their scar have it really tight on one side, and actually it sort of pulls their pelvis a little bit and can twist their pelvis and cause things not to move as well. So working on that scar, working on it on your own is really important. You can kind of do some massage work at home too, but also working on the scar and its layers and how it's related to the spine and to the pelvis and to the organs that are sitting underneath it is really, really important.
Yeah, I think that's what drew me to start taking some like visceral fascial courses.
Mm,
Because definitely I don't learn it to the depth that you do. But what I was finding is that like people would come see me for things like leaking, prolapse, pain with intercourse. And of course, like I feel quite comfortable with the pelvic floor and like the pelvic organs that I feel, the bladder, the rectum, the vagina, and the uterus. But you could tell that there was something else going on. Do you know what I mean? And there, we talk a lot about the pelvic floor and the diaphragm, but there's like all this stuff in between.
yeah.
And so I've really been fascinated with how often now that I've learned a little bit more that people's leaking is related more to like their bladder not moving freely, or like maybe their kidney not even moving freely, or their diaphragm being bound down on one side, or the urethra being pulled. Do you know what I mean? It's just like endless.
Mm-hmm.
And that's why it's hard to say when people say, why am I leaking? I'm like, geez, like there could be so many reasons, but not to mean that you like have to treat 7,000 things. But sometimes if you just impact one, you will have an impact on all of them
Mm-hmm.
because they're all connected. And so I think that's the complexity is that they're connected, but the beauty is that they're connected, right?
Absolutely. And even for something like that, if you're again coming back to the sacrum again and all the nerves that come out of the sacrum, that come out of the spine, if we have a twist in the sacrum or a sacrum that's not moving properly or irritation from something, that can affect the nerve, and that can affect the, how those nerves that are supplying all the pelvic organs, how they can then function as well.
Totally. And I was thinking when you were describing the sense of, I think it was the uterus with the small intestine, how it creates a pull down. Like
Mhm.
right away, I thought of prolapse. Like, do you know what I mean? When you
Yeah.
think of like a pressure that's being pulled down by tension, like the uterus says afterwards, like, I need to get down here. But if
Yep.
it's kind of adhered to this, it's going to start to pull, and all of a sudden, everything down here feels caved in on,
That's right.
And
Yeah.
so yeah, you can do Kegels till the cows come home, but if there's still pressure from up here, you
Mhm.
know, so I find this stuff just fascinating.
Mhm.
So we've talked a little bit about kind of how the abdomen and the pelvis are affected, but maybe speak a little bit to, let's go higher up the spine quickly and talk about, because so many moms are, whether they're nursing or bottle feeding or just cuddling, we spend a lot of time like this. So not only do we get neck and back tension, but a lot of headaches. So
Yep.
what if you speak a little bit about the relationship between all of that and what would bring someone in for headaches?
For sure. So, I mean, headaches are a common during pregnancy, common postpartum as well. Um, and so sometimes, there can be a whole variety of reasons, other reasons for headaches, dehydration or stress or fatigue. But, an interesting one is when we look at that sacrum again. So the sacrum has attachment, this connective tissue that basically wraps around the spinal cord. And so it starts out covering the brain, and then it comes attaches to the upper neck, and then goes around that spinal cord, travels all the way down to our sacrum and attaches there. So if we have any mobility issues in the sacrum, or if we've had, again, this pressure lower down, this tugging, this pull, basically that dura, that connective tissue wrapping, can get pulled on. And so sometimes that can impact on that gliding and sliding that we need to have throughout the whole cranial sacral system. And that can impact on headaches. That can basically cause this tugging, pulling feeling up at the top that is actually coming from down below. And so that's a really common cause of headache. And that can just be generally from birth. It can also be from an epidural. It can be, there's a few different things that can cause that to not move the way that we want it to. Yeah.
Fascinating.
Yeah.
I know I always like to keep this community very much about mom, because I think so much of our life is about babies after we have babies. So
Mhm.
I want to keep this primarily about moms. However, all moms have a baby that are here. And so I know that you see a lot of babies too.
Mhm.
Can you just so that the moms know,
Yeah.
why might they bring their baby to you?
Mhm. So some of the most common things that I see babies for are reflux. So yeah, reflux, latching issues, breastfeeding issues, constipation, preferring just to look over, their head one way or another, which can then contribute sometimes to that flat head on one side. Those are some of the colic. Those are some of the biggest things that I'll see a baby for. And osteopathic treatment is very gentle, very relaxing usually for baby. And most of the time we're looking again at what's the sacrum doing, how does the sacrum move, and how is their cranium moving, how are all those bones in their skull moving. And really in a baby, they're not really bones yet. They're like little bony islands in membrane. And so because baby's head has had to pass through the pelvis, there's a lot of molding and things that can happen. And during the birthing process, there can be a lot of compression that can happen to that baby's head. And sometimes that can get resolved completely on its own. And other times, particularly in more traumatic births, so ones that maybe have involved intervention, C-section, forceps, vacuum, that can cause quite a bit more compression on the baby's head and make it so that there's a particular area that's not moving as well. And that's something that we look at and make sure is as mobile as possible. Mhm.
Awesome.
Yeah.
I think it's all great. And I'm glad that like you're a resource here in town. I think I'll get like once we're done here, make sure to I'll get you to link. I know you're busy. I'll get you to link though where people can find you. Just so that if they want to reach out. And we'll also make sure to link how every country is very different.
It is. Yeah.
It's the same with physiotherapy or physical therapy. So it's hard to say what everybody should do. But if you are somewhere and you're wondering how to find someone, why don't you just comment below this video and we'll do our best to try to guide you.
Right.
And please don't hesitate to ask questions. That's how you learn.
Mhm.
So please do post and I'll make sure that Elaine's there to help me answer the questions. And is there anything else, Elaine, that you feel like I didn't ask you that we should make sure this population knows?
I think we kind of touched on all the
Yeah, I
things
think we
that we
touched
were
on the big
gonna.
things that I get asked about.
Yeah. Mhm.
And yeah, like I said, you go ahead and ask your questions. We'll post some links below. And yeah, I really appreciate you taking the time. This is a Friday afternoon.
No
Um,
problem.
yeah, and I was just gonna say we can go have a glass of wine now, but you can't. So I'll have two, one for me and one for you.
There we go. In a few more
But
months, we'll have to take a rain check on that
exactly.
one.
Yes, I'll cuddle your baby while you drink wine.
Perfect.
But yes, I look forward to doing something else in the future. And yeah, good luck with everything to come for you and baby.
Thank you so much. Thanks for having me as well.
Yeah.